Hi, everybody. My name is Misty Delgado. I am with Relivar Home Care and Alivity Care Advocates, and we are a company that assists families that are worried, overwhelmed, or stressed over an aging parent's health or safety. If you're in that situation and you need either private duty home care services or care management assessments and oversight to help you figure out what to do, you can please give us a call. But today we are talking about education, helping you understand. As care managers, one of the things we want to do is find out how to get the best care that we can for our clients. And we are excited because today I want to introduce to you, first of all, Krista Rolando. She's our administrator. Hi, Krista.
Hi, everyone. I'm so excited to talk about this topic today.
Yes, wounds. We're talking about wounds. And so we are talking today with Michelle Marine from Mendota Health, Mobile Wound Care and Clinic. So hi, Michelle.
Hello, everyone. Thank you so much for having us.
Yeah, so I'm so excited to have you because wounds are a big problem today for a lot of folks.
Absolutely. Absolutely. You'd be surprised how many folks are susceptible to wounds or have wounds. So we're thrilled to be a part of healing up that process and being just a great resource for folks to get the care that they need and deserve right in their own homes.
Right. So, the thing is about wounds is so many people are coming out of the nursing homes and or hospitals with wounds today that, or they're acquiring them that at home due to, multiple reasons. So I want to start first with understanding about Mendota Health, because last time we talked, they're new into the marketplace, and a little bit about your background. So can you give us some information on that?
Yes, absolutely. Thrilled to do that. So as you mentioned, Mendota Health, we're a mobile wound care company. We are a national company now in 13 states with a desire to eventually be in every state. Relatively new to the market. We'll be about 2 years old later this month, which is March. And we're very proud of the work that we do, going into folks' homes, apartments, senior communities, skilled nursing facilities, wherever they might be, that they might need some wound care. We can essentially bring a hospital-like wound care clinic right into the comfort of their homes or apartments. I have been with the company for about 9 months now, and my background, kind of twofold. I moved into the healthcare industry around 5 years ago, working as community relations director, which was my current title at Mendota. And I began working at a brain injury facility devoted to folks who had been in auto accidents and suffered brain injuries. So I was a community relations director there. And then I spent some time at Oak Street Health, which is a primary care physician's office dedicated to seniors on Medicare. And then for a short time, I worked for a vascular surgeon. So you may know that sometimes vascular issues go hand in hand with wounds. So I was particularly intrigued by that. And when an opportunity became available, I was thrilled to join Mendota Health with an exciting mission to really alleviate pain and suffering. And as I said, to just be a great resource for folks that might be experiencing advanced stage wound. As folks may or may not know, wounds are staged similar to cancer, stages 1 through 4, with 1 being less severe and 4 being the most severe. So we at Mendota look at stage 3 and 4 wounds, complex wounds, or any wound that is not healed with 4 weeks or more of traditional wound care treatment. Additionally, some exciting news, we've also been approved to take care of any stage diabetic foot wound. So as you may know, diabetic foot wounds can be tricky. They can look relatively minor, but once you go into the treatment process and start doing what we call debriding or removal of the dead necrotic tissue, they can be quite intense under the skin. So it's not visible to the eye a lot of times. So people tend to overlook it and think that perhaps it's something that's rather minor when it could be a more serious issue. So we're thrilled to be able to now take care of those wounds and get those healed up before they become a serious situation. We've all seen and heard about folks facing even possible amputation with a diabetic foot wound. So we are about taking care of that situation before it escalates to that point, so that we can hopefully avoid any possible amputations or sepsis infection setting in. We want to get in and take care of those wounds really quickly.
Right.
Yeah.
Yeah, I appreciate that. And, your company being new to this market, and, I've been in the industry for 20 years and never heard about a specialty wound care company like yours. So I was super excited to have you, come and do this recording with us because, when you said to me an average of 8 to 10 weeks to heal a stage 3 or 4 wound, that's amazing. I mean, you have some great stories of really helping people that have struggled with long-term chronic wounds and healing them. So, as a group here, we
Sure.
really want to know about it. Before we get too far into that, though, can we just talk a little bit more about how are these folks getting these wounds? What are the main areas that we're seeing? I know you said
Sure.
diabetic, but what else?
Yeah, so that's a very good question. Yes, so diabetes is often a major point where someone would be susceptible to having a wound, but really any of us can suffer a wound. It could be from something like a cut that's, maybe gets some dirt in it or an infection sets in. But what we see a lot of, we see post-surgical wounds. So someone might have surgery for any reason. It could be maybe heart surgery, back surgery, anywhere really on the body. And for whatever reason, sometimes that wound doesn't heal as quickly or as completely as it should. So we see a number of post-surgical wounds. We also see what we call venous stasis wounds. Those can result from a vascular type issue. One of the great things that we do for every patient on our very first visit is what we call an ankle brachial index test, or an ABI test, if anyone is familiar with that term. It involves either like a blood pressure cuff or sometimes a pulse ox on the finger and the toe, and it allows us to look at the circulation of the limbs. So we want to double check, make sure there's not a vascular issue. Some folks do suffer from vascular disease. And of course, we would make a great referral if someone has a vascular situation, because no matter what we would do to that wound, it wouldn't heal properly if that blood is not flowing. So we always check for any vascular issues. Another reason someone might suffer a wound is if they have any type of an ostomy. If you're familiar with those, sometimes the tubing can be a little abrasive on the skin and create a wound there. So we're able to take care of any type of ostomy wound. Let's see. We're also able to take care of any burns. If you've seen anyone with kind of a major burn, you'll see that it develops a wound around that burn, and we're able to take care of that as well. We can also apply wound vacs. If anyone is not familiar with that, in layman's term, I like to describe it as sort of a sponge, if you will, that goes over the wound bed, and then it's got like a clear sheet of plastic on the top of it, and then it's attached to a suction, which goes to an electric motor, and so that it really, in a sense, acts like a vacuum. So if you'll think about that sponge kind of absorbing the liquid from the wound, and then pulling it out through that tubing, which of course is then emptied and cleaned on a regular basis. So we're able to apply wound vacs if we determine that someone would benefit from that, or if they have an existing wound vac, we're able to go ahead and take care of the wound around that situation. So those are some of the more common reasons that someone might develop a wound. Also pressure wounds, especially with elderly who might be bedbound or who might be wheelchair bound. I know in years back, they were often called bed sores. Now they're called pressure wounds. So we see a number of folks that have abrasion maybe on the heel if they're bed bound, just rubbing against a sheet. We wouldn't think about that causing a wound. But when we're not mobile, when we're not able to be mobile, just the irritation of skin rubbing against a piece of fabric can cause a wound. And then we see a number of coccyx wounds, especially if folks might be in a wheelchair situation, which ideally they should be repositioned every 15 minutes. And that's rather difficult to do from a care standpoint. So we see a number of coccyx wounds and pressure wounds. And we have, as I said, a really great track record of taking care of those types of wounds. And because we're nurse practitioners, we can write prescriptions if there might be an infection around a wound. And we can also write prescriptions for things like maybe an air mattress or maybe a special cushion for a wheelchair. So some ancillary type things that will help alleviate pressure for that patient so that that wound can heal properly and not continually be scraping against fabric or a bed or a seat cushion, things of that nature.
I am so glad you brought that up about the bed.
Yes.
I can't tell you even how many times we've worked with, a discharge planner didn't, even though the person's going home with a stage
Right.
3 or 4 wound, they just order the basic bed from, the medical equipment company.
Right.
And, we're back circling back into the hospital with, sepsis and other issues,
Yeah,
the
of
wounds
course.
getting worse. And so, that is wonderful. Like, it sounds like you guys are really looking at the overall big picture, not just like, oh, let's just deal with this wound here today.
Yeah, that's a great point, Misty. And to that point, every time that we see a patient, the first time that we come out, we do what's called an assessment visit. And so our first visit, we plan to spend at least 2 hours. So I would imagine if someone went to a doctor's office, it would be rare that they would spend 2 hours with their doctor. But we really take a very intensive look. So as you said, not only at that wound, but we're looking at the person's overall health. We're looking for other health issues that may be present. We are doing things like checking nutrition, checking hydration. As you know, if someone doesn't have a proper diet, for instance, they need an abundance of protein when they're going through the healing process with a complex wound. So we make sure that they're eating properly. And especially with our elderly population, we do bill through Medicare Part B. So most of our patients happen to be seniors. And especially with that population, as you may know, their skin can become a little thinner and a little less flexible. And so they might be a little more susceptible to surface wounds, skin tears, things like that. Just, the skin opening up just from some normal abrasion, for instance. So we're looking at things like that. We're checking, we'll even look in the refrigerator and make sure that they do have proper nutrition. Maybe if they're getting Meals on Wheels, we want to make sure they're not stacked up in the refrigerator uneaten. And most importantly, we also double check that med box. So the med box can be our friend when they are filled and distributed properly, but sometimes well-meaning family member, we had a patient recently that was very lethargic, and our nurse practitioner was speaking with her. And she said, she was just really tired all the time, and that wasn't normal for her. So she starts looking at the med box and discovers that the person is taking Tylenol PM around the clock inadvertently. Her family had bought it, the wrong type of medication at the drugstore, and put it in a med box. So I thought, gosh, had that poor person just gone to a clinic or to their personal physician, that error probably would have never been caught. So we double check that. We're also looking for any safety hazards in the home situation. It could be as simple as a throw rug, which looks really innocent. But for those of us in healthcare, we know that those simple things can catch someone's foot, and next thing you know, there's a trip and fall and maybe a breaking of a bone. So we look for things like that, things like maybe boxes in the hallway or anything that might be a hazard for someone to navigate their home situation. So that's why we really pride ourselves not only on taking care of that wound really excellently, but also looking at the overall health, the overall person, and really educating. So as that nurse is working on that patient, they're constantly educating and speaking with them about other ways that they can protect and maintain their overall health. So we want folks to have as healthy and vital life as they can possibly have by our taking care of their wounds and our taking a secondary look at any other needs. And if we determine, for instance, that someone maybe doesn't have home care and we believe they would really benefit from that, perhaps we're seeing that they're not showering as frequently as they could, or that they're having difficulty maybe getting dressed in the morning, or maybe they need some help with general household chores or meal preparation. So we are thrilled to make these great relationships so that we can refer excellent home care agencies such as yourselves, that they're rounding out their care. And so our nurses can take care of writing a script for that and getting the approval through the primary care doctor, so that especially our seniors have the care in their home that they need and deserve.
Sure. Well, I mean, it sounds like what you guys are doing is an overall big picture thing, not just a small, like, we're going to just deal with this wound on the bottom, which a lot of
Right.
times, when they get discharged from a hospital, you've got typically a normal home health agency going in there, and they
Yes.
may have a wound care nurse,
Mhm.
RN, typically, that's going to start treating that wound. But
Right.
you guys are definitely a little bit or a lot different in that
Yeah.
you're really trying to look at this big picture, and you're looking and wanting some concrete success rates in a quick amount of time.
Absolutely. Absolutely. And to your point, so like I said, we're thrilled to have those partnerships and very respectful of the RNs that do work at home care agencies. And to your point, they're able to do the basic wound care for like the stage 1 and 2 wounds. But when it gets to a more difficult level, to the stage 3 and the stage 4, that's where we come in as hopefully a valued partner, because we're able to do a few things that the RNs cannot do. So we're able to do debridement. For those unfamiliar, debridement is the medical terminology when we go in with a scalpel and we need to remove necrotic or dead tissue to reveal that healthy tissue underneath the scab or the dead tissue. And then secondarily, we use a product, an advanced wound care treatment product called cellular tissue product, or sometimes you might hear that abbreviated as CTP. And that is what I call a super healer agent. Um, I think of it sort of on par as sort of some stem cells, how they accelerate healing. And cellular tissue product does that same thing. So it looks like a thick piece of saran, if you will, for lack of a better descriptor in layman's terms. And we place that right into that wound bed. So once we debride, we remove that dead tissue. We oftentimes will treat with a cellular tissue product, place that right into the wound bed. And so it does its work by absorbing into that wound bed. So typically when we use that product, we usually treat about once a week, because it requires time to absorb into that wound bed and do its healing work. So we look to our valued home care partners to help and be our second pair of eyes in between our weekly visits, to double check that outer dressing, make sure that it's clean, dry, and sterile. For instance, after we leave from a treatment, if someone were to go in the shower and get that outer bandaging wet, it would not heal properly. So we really value our home care partners to help us be that second pair of eyes and make sure that that outer dressing is staying the way that it needs to, so that it's clean inside and that cellular tissue product is able to do its proper healing work.
So let's say I work for a home health agency and I'm the nurse providing this treatment to this wound, if I'm not seeing any improvement in it, and it's a stage 3 or 4,
Yes.
it would make sense to, call you guys in. It's just not gonna, I'm still gonna continue to go there and do what we're
Yes.
doing. You're the specialized level of care coming in to help
Yes.
bring it, to close it completely up. So it's, what you're doing is you're working in tandem with them,
Yes.
because it would be like a nurse working with a doctor, right? I mean, that's kind of what we're
Exactly.
doing. We're working together to improve the overall skill level. Now, some home health agencies, they can, work with stage 3 and 4 wounds.
Mhm.
But
Yes.
they don't have the same abilities to do what you guys do, because you're dealing with nurse practitioners. Am I correct there?
That is correct. And so to your point, usually a home care agency that does do wound care will typically have an RN or an LPN. And again, very respectful of those skills, and they're wonderful at taking care of those stage 1 and 2 wounds. But once you get into a stage 3 or a 4 wound, it really does require a lot of times that debridement. And so debridement is actually billed as a surgical procedure. And it does require either a nurse practitioner, a physician, or a surgeon in order to do that debridement and to work with the cellular tissue product as well. So a typical home care agency that has an RN would not even be able to order that cellular tissue product. So we would take care of ordering and treating and actually paying for that cellular tissue product for that patient. But again, to your point, we're not looking to compete with anyone or take over anyone's existing role. We want to come alongside and work along with that home care agency. And then once we do have that first visit, we're really big on communication. So first off, we want to make sure that any home care agency involved is able to reach out to our nurse practitioners anytime, day or night, with a quick message if something looks amiss or they have a quick question. We want to make ourselves very available so that we're working together in partnership. So every visit that we do a very extensive report, a post report that includes things like measurements. You'll see how deep is that wound bed, how wide is that wound bed, and are we moving in the right direction? Is it closing up week by week as we're coming in? And so we make that report available within 24 hours of every one of our visits. And we also ask that patient, who is what we call your circle of communication? So if that patient says to me, look, I want my daughter to know what's going on, I want my physician to know what's going on, and I want my home care agency to know what's going on, all three of those folks, or however many folks they designate, will receive our full report within 24 hours of every visit. So we're big on communication.
That's great. So I
Yes.
sort of look at this like if you go to your regular doctor for your, general care, and then you go to your, let's say, orthopedist for, those issues, it's very similar here. You're still working with your nurse with the home health agency, but if it's a stage 3 or 4, we're able to work with your company to get the higher level of care, the more specialized is what I would call it, specialized level of care for your wounds.
Yes, absolutely. And
Okay.
to your point, to add there, as I said, we are wound care specialists. So just to be really clear, we don't do other things. So
Right.
our full focus is wound care, and we really are considered a medical specialist, just like someone would go to, say, a cancer specialist or a kidney specialist. We are your designated wound care specialist. And to that point, we work under the direction of our medical director, Dr. Thomas Serena, who is a world-renowned wound care physician. He has actually founded a group called the Serena Group. So we all report up to him. All of our nurse practitioners are trained by Dr. Serena and his group, and he's highly sought out. He's given over 2,000 lectures and written over 100 papers on the topic of wound care. So a lot of folks go to him for his vast knowledge and his extreme passion for wound care. And even if a nurse practitioner maybe has an especially difficult case, she can virtually FaceTime with the Serena group and maybe get a consult if she would like, or she or he would like a second opinion on something. So again, really proud of the work that we do. And our nurses not only are their typical accreditation as a nurse practitioner, but they're constantly taking their CEUs, their continuing education courses, so that they've always got the latest and the greatest. There's always new things being developed on the wound care front. We want to make sure that we are at the forefront of the very best products and the very finest treatments. There is a new treatment here in Michigan referred to as ultrasound mist. And it is very effective. It kind of looks like a temperature gun, for lack of better descriptor for it. And it uses low frequency ultrasound along with misting a saline solution right into the wound bed. And that's a less invasive way of doing debridement, which again is that removal of the necrotic or dead tissue. So if for some reason someone is maybe having a little difficulty with the debridement process, and we of course make sure that they're fully numb and fully comfortable throughout that procedure. But if for some reason it's hard for them to tolerate, we can go on to that ultrasound mist. So when we do use that ultrasound mist, we usually do 2 visits a week rather than the 1 visit when we're doing the debridement and the cellular tissue product.
So I think the important thing that, is that it sounds like you guys are staying up on, because you're in this lane, you're only in this lane. You're not going into hospice. You're not going into home health. We're staying in this wound care lane. We want to be the best at we can do.
Absolutely. Yep. And so we consider ourselves experts, and we don't have plans to diversify and do other things medically. We are just wound care specialists. And so to your point, Misty, we are always looking for continuous improvement. What is the latest and greatest product? There's always new products coming out. And so we want to be on that forefront, the cutting edge, if you will, on what is the very best way to heal those complex wounds in a relatively short time period. And just to go back a little bit, what we define as a complex wound is any wound that hasn't healed within 4 weeks of traditional treatment. So to your point, what might happen, Misty, is maybe if a home care agency is taking care of a wound and they're seeing that it's maybe what we call stalled. So they're treating, it's kind of staying there. It's not getting worse, but it's not getting better. That's when we can come in and really accelerate that healing. And some of those advanced products are really key to doing that. So we also ask when someone is referred to us that we require 3 weeks of wound care notes. And that's for a couple of reasons. One, we want to know what's been done to that wound already, so that if something is not working, we don't want to go backward and use that same treatment. And secondarily, we want to have integrity from an auditing standpoint and make sure that when we are audited, that we are proving that we are doing our due diligence to make sure that someone has received at least 4 weeks of traditional wound care, and then we come in as that advanced care specialist. So think of it in a way like you wouldn't go to, say a kidney specialist if you didn't have a kidney issue. So we want to make sure that we are having integrity with the services that we're providing, that they truly are complex wounds. And sometimes, we always like to err on the side of being overly cautious. So sometimes we may go out and do a first assessment, and we may discover that maybe that wound is a stage 2 and not a stage 3. So again, from an integrity standpoint, we would then make a great referral for either home care or maybe a wound care clinic to take care of that stage 1 or 2 wound while we take care of the stage 3 and 4. But if there's a questionable, we're not sure if it's a 2 or a 3, and sometimes depending on who the provider is, they might have a little bit different criteria in terms of how they're designating what stage a wound is. We would rather err on something maybe being not as severe and make a nice referral rather than assume it's not a 3 or a 4 when it may in fact be. But just know that cross referring situation, we love having those great partners so that we have someone to refer to if we say, gosh, we looked at Miss Smith and we discovered that her wound is really a 2, it's a blistering situation. We want to make sure that we're making that proper referral so that that patient can get the appropriate care so it doesn't escalate to a 3 or 4.
It's interesting, like we have an RN on staff and she loves doing wounds. It's like really, right, Krista? Like it's her passion, because you can really like see the progress here, as it's coming down. And I'm sure there's a lot of nurses out there that, that don't want to handle it, but there's a lot of them that just love working with the wounds. Yeah.
We chuckle at that because we are wound care 24/7. I love talking with my nurse practitioners. And to your point, Misty, they'll say something like, oh my gosh, we saw Mr. Smith yesterday and, it was such an intense wound. We had someone recently that it was such a deep coccyx wound that the nurse was able to actually put her fist completely into that wound.
Oh, whoa.
And to your point, instead of them being sort of mortified to look at that, they're like, oh my gosh, they were so excited because it's a challenge. They look at it, as we should, that it's a challenge. And so I want to say that there's really hardly ever a wound that we can't heal. We had a gentleman recently that had a 7-year continuous wound on and off, on and off. Now, that did take us about 7 months to close him completely because it was so terribly deep and terribly difficult. But our nurse was so, so proud to be able to report that after 7 months, she was like, I closed him completely. And we saw the photos and we were all high-fiving and congratulating and all of that. So we're really proud of that. And to your point, anyone that is devoted to wound care the way that we are, that passion is really, really obvious. I love when I see a nurse that says, I love wound care.
Wound, you're going down.
Yeah,
Right?
exactly. They love that. They really love that.
Yeah.
It's great to have a company like you out there, for a couple different reasons that you mentioned, the continuous improvement. Any company who seeks that out is a good company, right? Because you're
Thank
looking
you.
constantly trying to make yourselves better. And the other thing is that the word wound is really scary.
It
And
is. It is.
I haven't dealt with it before, or haven't dealt with a company like you, it can be a really detrimental thing. And so
Absolutely.
knowing that you're out there and you're able to help with especially these complex wounds is just really good to know. And I'm sure you guys are doing great with people out there. So I appreciate what you do.
Thank you. Thank you so much. We're very proud on that front. And like I said, we're specialists. This is all we do. It's our passion. It's our drive. And to your point, people sometimes don't realize how serious a wound can be. They may look at it and think that it's just, something, a relatively minor situation. And sometimes, especially with our elderly population, believe it or not, there's a lot of shame sometimes around wounds. Sometimes people are embarrassed by it because they feel that in some way, maybe they didn't do things properly, or maybe they're being judged as being unclean. And that is not the case. Any one of us could be susceptible to a wound if we even just have a little open cut and don't realize that maybe some, dirt gets into it, or maybe some, cleaning solution when we're going about some housework. So it's nothing to be ashamed or embarrassed of. And so that's part of our work too, is that we want to eliminate any shame, any judgment, any embarrassment around a wound. So not only are our nurse practitioners amazing medically, but they are so kind and caring and understanding and compassionate with our patients. Like I said, a lot of times they'll put an ACE bandage around it. They'll not tell their families about it. They'll not tell their home care agencies about it. Sometimes a patient might not even be aware that there's a wound. And oftentimes our home care partners, maybe in helping someone dress or helping someone bathe, will discover a wound that the patient didn't even know was there, especially if it's a coccyx wound. Oftentimes, we're not looking at the backside of our bodies in a mirror necessarily. And so they might not realize that something's there. And we know how quickly things can escalate. So we don't want to let what looks like a minor wound go to the point where it could be susceptible to infection, and then on a more serious note lead to gangrene or sepsis, or even someone to have an amputation. So we want to come in and take care of those situations, get those wounds closed up so that they're not susceptible to infections.
Yeah, and I'm glad you mentioned the compassion piece, because you can
Yes.
be the best nurse there is, right? You can have all the
Right.
skills in the world, but if you don't have that compassion or that bedside manner, I guess you would
Right.
say it doesn't really mean anything, because you're not going to connect with that person. And
Yes,
a lot of times that's the number one thing they need, is that
for
connection.
sure. For sure. And so we really pride ourselves on that. That is as important as their medical ability to heal a wound. I'm very proud that our CEO, when I first joined the company, and he actually took personal time to train with us and talk with us and ask us why we joined the company. And he said something that I thought was very interesting. He said, I don't care as much if an NP is able to close a wound as I do if they have the right caring persona. He said, I can teach anybody to close a wound, but I can't teach them to care and be compassionate and be kind and really treat someone with understanding and a genuineness. And we also try to pair that same nurse practitioner with that same patient throughout their treatment, so that we're not switching people up every visit and they come to know that, oh, Nurse Jennifer is going to take great care of me on Wednesdays at 2 o'clock. They come to expect that and know that. And we really try to take our time, to your point, Krista, to really get to know our patients, to kind of see, what's their lifestyle like? What hobbies might they have? We want to get them back to the most vital life they can possibly have and to encourage them. And to your point, especially with the pandemic, we know what social isolation has done. And
Yes.
so we're very cognizant that we are a guest in our patients' homes, and we want to act accordingly as a guest. And we also want to, be that friendly voice to them, that friendly presence to them, so that they feel that they are being cared for as if they were a family member. We really try to treat all of our patients like family, and get to know them and be respectful. I'm so pleased that we get a lot of, notes or phone calls back saying how pleased they were with the nurse practitioner that took care of them, not only medically, but to be so kind and to be so caring and compassionate. And as we know, if someone's not passionate about something like this, they're probably not going to last very long in the field. So I feel like all of our, especially nurse practitioners and everyone from the schedulers to our accountants to our senior management, if they don't have that passion and that drive and that deep, deep care, especially for our senior audience, they're probably in the wrong industry. So
Yeah.
we're really big on hiring the right persona. We can teach people skills, but we can't teach them to be kind or to be extra caring or extra patient with someone.
Yeah, we say that all the time here. I do a lot of the hiring, and
Yeah.
I say it all the time. I can train
Right.
skills all day. We can do
Yes.
that.
Yeah,
We can't train you to be a good person.
that's
And
right.
if you're coming here just to collect a paycheck, please don't waste our time, because we're caring.
Exactly. So that's a big part of our corporate mission. Many of our, our corporate standards and things refer to things like that. Are you a person of integrity? Do you care deeply? Are you patient? Are you kind? Are you willing to educate? So like I said, we don't want to just go in and, okay, we dress this wound, we're in, we're out. We want to make sure we're looking at the whole person, a holistic view of health, and really being respectful of folks, especially if they've been isolated, or maybe they don't have a family member at all. Maybe we are their family in some cases, as is the home care agencies. Those aides become part of their extended family. And so we want to be really respectful of that. And I believe that when we operate from a place of passion, we are going to be successful no matter what. So we have the key ingredients, we have that core knowledge, but if we don't have that passion, we'll just be like any other industry. But we are so involved and so dedicated to building that passion and that team of the right professionals that we're really proud of all of our colleagues, especially our nurse practitioners on the front line with folks.
Well, I would probably say that that's the reason why your company's been so successful too.
Thank you. We like to think so. We're a fun company. We care deeply. We are all virtual, so all of us, operate out of a home office, and we do our best to really be connected, not only with each other, but with our patients. And I believe that we've done a really nice job of that, and just kind of building that reputation. And so a lot of it is word of mouth too. So we hope that anyone that has benefited from our care might, share with us that other maybe neighbors or other folks that live in their senior communities that need some help, might recommend us. And we know that word of mouth advertising is sometimes the best form of advertising that there is.
Right.
One thing I want to make sure we touch on is the fact, because we do it as well with our home care, is for that level of consistency.
Yeah.
And I know typically our clients want consistency, but it also does another thing, which is you're seeing a pattern on an individual. And when that pattern changes, and it might just be slight. I mean, we talk about here, it's, a woman's intuition that
Yeah.
something's off today.
Right.
I can't put my finger on it, but just something doesn't seem right with, Mrs. Smith. And if you're constantly changing staff, they're
Right.
not going to recognize the change, the
Mhm.
slight changes that somebody who's been there for the last month or so, that they're going to see it and then be able to change the direction of what, or, communicate or make changes in orders or whatever might be
Sure.
happening, do testing. So I love the fact that you're, trying to keep that overall consistency as well, because that improves outcomes is what we're all trying to accomplish, right?
Absolutely. Absolutely. And of course, there's going to be those outlying cases where someone's ill or someone's child is, off of school unexpectedly. But generally speaking, yes, we try to, again, pair that same nurse practitioner with that patient, and for a reason, for medical reasons, obviously, and then for a comfort level for that patient to feel that they know that person, they trust that person. Especially sometimes, I know our senior audience can sometimes experience folks that maybe don't have the best of intentions. Maybe a sales call comes in and it's not legitimate, things like that. So we really feel that it's important to build that rapport and to build that trust. And we want them to come and know and expect that that very same nurse is going to care for them week after week. And, some of our folks also have memory issues too. So we want to, keep in mind that, we'll do reminders for their appointments, and then, leave a little written instruction in terms of what was done on that visit and what to expect on the next visit and when that next visit is. So we do our best to, try to keep that consistency and to build that rapport. Like I said, we really care deeply about what we do and how we do it, and how we develop that trust with our patients. We want to be trustworthy healthcare partners and specialists for our patients. So that is extremely important to us.
Yeah, that's awesome. So just to kind of go through this list here,
Sure.
we say complex stage 3 and 4 wounds, but when it comes to a diabetic, you could do any stage.
That is correct. So
Okay.
most recently, we've been approved to take care of any stage diabetic foot wound. So just a little note on that. Even if it looks rather small, it might look to be the size of a pea. And someone might think that, well, it's just a little scrape or a little sore or whatever. Please don't assume that, because especially with a diabetic foot wound, there can be infection beneath the surface of that skin that's not visible to the eye. But once we would go in and start debridement, sometimes that infection has already gone into the bone, because there's such a small area in that foot that is relatively easy to happen. So what I would say to anyone out there, if you have a loved one that has any type of a diabetic foot wound, please, have that checked out. Don't make an assumption that it's just a small, minor situation, because that can escalate really quickly. So we're thrilled that we've been approved, to your point, Misty, to take care of any stage diabetic foot wound, no matter the staging.
Yeah. And in that instance, like if my loved one has that, I have to call my physician to get an order to work with your company.
I'm glad you asked that, Misty. We do not require a physician's referral.
Okay.
So anyone can make that referral. And to your point, oftentimes it is a family member, or sometimes it's the patient themselves, or oftentimes it's a home care worker who maybe sees a situation unfolding, and they can contact us right away and fill out our intake form, which is located on our website, mendotahealth.com. Or if I'm working with you one-on-one, I can certainly send you a file of that form. But yes, anyone can make a referral.
Okay.
And then we go through, I may have mentioned we bill through Medicare Part B, needs to be their primary form of insurance in order for us to bill. So Medicare B.
Medicare B. So
Correct.
We're really looking at the folks that are on Medicare to get your services.
That is correct.
Okay.
And so as folks may know, most people with Medicare are age 65 and older. However, someone can have their Medicare earlier than that if they have a disability for 24 continuous months. So we do have a small percentage of our population that's under age 65.
Got it. Okay. And so the unique thing about your company is your nurse practitioners. You're teaming up with
Yes.
Medicare home health agencies as
Right.
well. When, an RN, can refer to you as well if they're not able to get that wound closed, if that wound is escalating. Your
Mhm.
nurse practitioners have a higher skill level, a higher level
Yes.
of ability to write orders and do treatments that a regular, home health agency would not be able to do.
Yes, that is correct.
Okay.
And just to reiterate one more time, so the nurse practitioners are able to do that debridement and that cellular tissue product. So those are two things that an RN can be fantastic and the best RN out there, but they're not able to do that debridement because it is a surgical procedure, and they're not able to even order or use cellular tissue product, which is really kind of our most common way of treating those complex wounds.
So in a normal situation, if they were going to have that treatment done, it would be in an outpatient setting where you actually have the ability to do it in the home.
That is correct. That is correct. So normally they would have to go, say, to a wound care clinic or sometimes to a hospital in order to receive those advanced treatments. And so to your point, especially with the senior audience and with it being winter or spring or whatever it is out here now, with the weather, anytime that our seniors go out, they're susceptible to, a slip and fall. And then we've got a broken hip situation. So the less that we have to transport our seniors, especially in the winter and especially with things lingering like COVID and the flu season and RSV, the fact that we're coming into their homes and keeping them safe in their home setting is really important. The less that we have to get them out there to a clinic where they might be susceptible to other folks in a waiting room or in a hospital, we want to provide that extra measure of safety. And a lot of folks might have mobility issues. So maybe it's really hard for them to walk, or maybe they're bed bound, or maybe they're wheelchair bound. Extra hard for them to get to their appointments. And one interesting thing is that I often partner with wound care clinics, which might sound to someone like that's rather silly because they're our competition. Yes and no, but when I meet with them, I simply ask about their non-compliant patients. So if they have any patients that they know can't make it to their appointment regularly, maybe they're no-shows, maybe they don't have family, maybe they don't have access to transportation, for whatever reason, if they can't make it to a wound care clinic, we partner up to be that resource so that we can bring the care right into their homes.
That's awesome. Yeah. It's such a needed service. It's a specialty, but it's so needed.
Thank you. We really saw that need. So how we were founded, our CEO actually had a visiting primary care doctor service. And in doing that, he discovered what that need was, that so many people had wounds. And to your point, a primary care doctor can do so much, but they might be coming to the home and taking care of maybe 10 or 15 things. And, wound care is maybe not their specialty. So he really saw a need and a niche in the market, and he founded this company in the middle of COVID. So especially proud of the fact that we were able to succeed in the midst of COVID and as a virtual company going national, and only 2 years in business. We're really proud of the fact that we're growing as quickly as we are.
Awesome. And the last thing is, this personalized care that you mentioned and the oversight. We're not just looking at the wound. We're talking about nutrition. We're talking about what kind of bed they're sleeping on. We're looking at the safety in the home. We're looking at the medications to ensure that they're being set up right, that they're taking them right. We can order, your nurse practitioners can order medications right away if it's needed. There's no delay.
Yes.
I have to get a hold of the doctor and get an order, and then the family has to go and pick it up. And could be a fair amount of delay, especially if we're in a community. Sometimes the communities, there's, it could be 2 to 3 days by the time they actually get the pharmacy to deliver that stuff.
Absolutely. So we do pride ourselves on timeliness, to your point, Misty. Try to be as quickly reactive to a patient as possible, to see them quickly, and to your point, to be able to write those scripts and not have to delay, especially if we see someone has an infection. Our NP is going to write a script for that, even on that first assessment. Also, if they determine that debridement is necessary, that will usually happen on that first assessment. We're not going to wait. If we see that something needs to be done, time is of the essence with wounds. So we know that things can escalate in a matter of days. And we do our best to be very proactive with seeing that patient quickly, getting them taken care of, getting, developing that unique care plan. I don't think I touched on that, but we develop a unique care plan that's shared with all of their circle of communication that I spoke of earlier. So their family members or their home care aides or their primary care physicians, whoever they would like to be apprised of their situation, gets a copy of that care plan. And so we want to give a real-time picture to anyone involved with that patient, of course, with their permission, so that anyone could take a look at that report and know exactly where that wound stands and can see the progression, especially because we're doing measurements. So it's not just our judgment of, oh, it looks better, but we're actually showing you the measurements of the depth of that wound bed and the width of that wound bed so that we can show that it's moving to a closure process and how quickly that can happen.
Right. That's amazing.
Yeah.
Well, Michelle, we're so excited to, have met you and know
Thank
that we've
you.
got you in our back pocket as a resource for our clients. And we appreciate you taking the time here today to go through this with us. And folks, thanks for joining us today. If you have someone who is in need of care management services, you have a family that needs someone to help decide what to do with a loved one, or you're having difficulty making decisions, you can give us a call here at Relivar Home Care and Alivity Care Advocates, or you can call Michelle if you have a loved one that has a wound. And I'm sure either way, whether if it's a stage 2 or 3, she can help you along and help you figure that out. It's worth it just to make the phone call. And again, thank you so much, Michelle. Thank you, Krista, for helping us get through this presentation. And you guys take care.
You too.
Thank you. Thanks for having us.